A deadly virus with even deadlier results for communities of color. This as COVID-19 has claimed the lives of thousands across the country, but its impact detrimental for minority people. That's only compounded by issues with a slow distribution plan, and these concerns sparking a Wednesday night virtual town hall.
We want to get to the heart of the matter, which is COVID-19 in Black and Brown communities and what we're going to do about it.
Hosted by the Baltimore Action Catalyst team, multiple panelists from city leaders to health professionals discussing the issues with COVID-19 treatment and access to vaccines in minority communities. Right now, Maryland is within its first phase of its distribution plan. This as, according to health metrics, out of the nearly 40,000 cases in Baltimore City, Black people make up for more than half of those cases. The number of Black people who make up in deaths even more troubling.
Right now, we know at the city of Baltimore that about 70% of the deaths are African Americans. But we also know that when we talk about the first dose of vaccinations, that we are disproportionately receiving them. I think there was a state report that came out that showed that we only received 15% of that first dose statewide. This is completely unacceptable.
City and health leaders say they've come up with several initiatives to reach those vulnerable communities, helping to bridge the gap deepened by the pandemic.
So early on in the pandemic, we launched mobile testing teams. We recognize that there are many communities throughout the city that don't have access to testing. And so we made it a point to launch our mobile testing sites and go to those communities in highest need. Even if we weren't seeing large volumes, it was extremely important that we brought testing and we met people where they were.
I'm Trey Ward, WBAL TV 11 News.